Hi, I'm Rachel Crouch. I'm a second-year RN student, and along with Bridget Mayfield, I will be presenting ostomy site assessment and care.
Hi, my name is Bridget Mayfield, and I'm a second-year RN student. Along with Rachel Crouch, we're going to be presenting also how to use the materials for a colostomy. To start out, you're going to perform hand hygiene and put on disposable gloves. Supplies you're going to need at the bedside for this skill include a new pouch, a new wafer, a measuring guide, scissors, adhesive remover, a plush towel, and possibly a basin with warm water and a washcloth, and your stethoscope. Initially, you're going to auscultate for bowel sounds. While you're doing this, observe existing skin around the stoma site, making sure that there's not any irritation. If this bag needs to be removed, obviously we're going to do that. You're going to make sure that you keep the clip on the end of the pouch. Observe the stoma for color, swelling, trauma, and healing. Stoma should be moist and reddish pink. Assess for the type of bud-like protrusion on the abdomen. Observe existing skin barrier and pouch for leakage and length of time in place. Depending on the type of the pouch system used, nurse may have to remove pouch to fully observe the stoma. Clear pouches permit viewing of stoma without their removal. Intact skin barriers with no evidence of leakage do not need to be changed daily and can remain in place for 3 to 5 days.
This bag and wafer have been here for 4 days, and the bag is half full, so instead of just changing the bag today, we will be changing the bag and the wafer. Alright, now we're going to remove the bag and the old wafer. You would start by placing a towel across the patient. To remove the bag, you want to make sure you put a little bit of pressure and hold on the wafer so that you do not pull on their abdomen. And be careful not to spill anything out of the bag. After removing the bag, make sure to take and dispose of the contents and make sure you measure. To remove the wafer, you're going to start at one edge and work your way around and work your way inside. Now we're going to get the basin of warm water with a washcloth. Starting at the side of the stoma, you're going to want to wash anything left around. Make sure you wash all the way around and out on the skin. After letting that dry, we're going to use the adhesive remover to remove any of the stickiness, being sure not to touch the stoma.
Okay, once you get the site all clean and it's ready to be redone, we're going to use a measuring guide to make sure that there's not excess skin around the stoma site that can be touched with bowel and whatever else that's coming out of the stoma. You don't want that sitting on the skin around the stoma. So we're going to use this guide to measure. We obviously don't want to use anything too large and we don't want to use anything too small. We're going to use just big enough to go around the stoma site, which this one is. So that's the one we're going to use. We're going to go ahead and cover the stoma site up while I cut the guide, just to make sure that nothing's falling directly near the stoma or coming out at us. So the guide shows us where we need to start cutting on the wafer. I'm going to use my scissors here. You want to make sure when you're cutting the wafer that you don't go too large at first. You want to make sure you cut small. You can always make it larger. You can't put any back on the wafer once you've already cut it. And you still need to take a little bit away from this, so. Okay, so we've got it cut. When you cut the wafer, you want to make sure that you don't leave any jagged edges, and when you place it around the stoma, you want to make sure that you get it in a correct location so that the adhesive part isn't going to be running into the belly button and any other obstacles that might be in its way. Okay, so when placing the wafer, remove the adhesive backing. We're going to put it on the stoma, or around the stoma. You're going to start on the inside, making sure that it adheres to the skin, and move our way out, away from the stoma. Okay, now that that's permanently in place, we're going to take our new bag that's clean, and you're going to again work your way around. You want to take into consideration how it will be easiest for either the patient or yourself to remove contents from it in the future. So you might not want to have this angled and facing up to the patient. Okay, you're going to go around in a circle a couple of times to make sure that the track has gone into place all the way around, and you might want to just pull up lightly to make sure that it's connected and secure. Then you're going to take the clip and fasten it and snap it into place. So everything should be secure at this point. This is all secure and the clip is in place. This we're still connected to our patient. Just to back up, to remove the contents, you would remove the clip that was from this side and allow the contents to leave the bag, and then you're going to clean the edge of the plastic a little bit and then re-clip it with the clip. One really important thing to keep in mind for patients that are experiencing an ostomy and colostomy, this might be a new experience for them. They might have some body image issues that would be completely understandable. You never want to make them uncomfortable about the odor. There is deodorant for colostomy bags that's available if that's an issue, or if they are bothered by it, or if they feel that their company or family members around them would be bothered by it. But just keep in mind that this is something that is something you've done, you can well handle, and that they don't have anything to be embarrassed about. And also another thing to remember is every time you go to empty a bag on a colostomy patient, it's a teaching experience for them, because most likely they're going to have it for a period of time that they're going to have to learn how to self-maintain this system, and they're going to have to know how to empty it and change it. So each time you're doing this, when they're ready, you need to use that as a learning experience for them.
We thank you very much for your time, and we hope that our video was very educational for you. Thank you.